been a foster parent to 50 children. There's a 0 on the end of that, 5. I feel exhausted just looking at some of the stuff you do. So you grew up in a home where there was mental illness, so having been a child of a parent with mental illness, but also you had a difficult birth of your 7th child and then diagnosed with postpartum psychosis and post-traumatic stress disorder. So you've kind of got a full circle of experience and life experience, and I guess this has been informing your work. Amanda has worked in both government and non-government sector in mental health, and it's just amazing. I'm just reading: personal care attendant, peer support worker, recovery support worker, carer consultant, and that's a really interesting hat that you wear there. Project worker, coordinator, recovery trainer and group facilitator. Currently you're working with Richmond Fellowship, and you're the coordinator for the Hearing Voices Western Australia. So if you're from WA, make sure you meet Amanda today. And I think there'll be some things that you'll kind of get light bulb moments when I talk with Amanda about some of her work. So make sure you chase her up at lunchtime and ask her lots of questions, because I think it's just amazing the stuff that you're doing. But what I wanted to talk to you today was about your Recovery Rocks program, because it says that you do this in your spare time.
Yes, that's right, John, I do.
How is this possible? Plus, I love the fact that Amanda loves fishing too, so I'm a bit envious. Tell me about the Recovery Rocks program. Who's it for, and what does it do?
Okay, John. Well, I guess from my own experience, I found that trying to live a life of recovery was a challenge within services, and I had a dream. It came to me that perhaps I was looking in the wrong place, and that what was needed was more a community, and the kind of support that I needed through my journey. In actual fact, I got moments of it in services, but began to realise that a lot of the kinds of support that I needed was something that was better found within a community than within a service.
Mm-hmm.
So I put out my idea, my dream, to others I knew who were on their recovery journey, and basically asked them to come around for a barbie and we'll have a talk about it. And that's what we did, and there was strong interest in perhaps we weren't really sure what we were going to do, but that we definitely needed to do something. We needed to try to create a place, a safe space, where through relationship we could support one another on our journeys of recovery. And so Recovery Rocks Community was born 20 months ago, and yeah, it's sort of been a bit of a journey, a learning journey, but we have very successfully created that place.
So it began as a support place for people who hear voices?
No, actually, no. It was people who had experienced mental distress in various shapes and sizes, whether it was in the past, whether it was presently, and it was about this word recovery that is quite an abstract concept. How can we make it more practical? And we didn't want just one of those other support groups where we all sit around and talk about what's not going right for us. To be properly recovery focused, I guess, it was to celebrate, to concentrate on the things that were going right for us, to be able to talk about that despite the challenges that we faced. We're actually able to, life's okay, we can get through this. And to us, that's what it was about, which was quite different from what was out there, and I believe still is.
Yeah. So it began initially really with people who were experiencing symptoms or experiencing distress, but then you've kind of morphed into that family, you've broadened it.
Yes.
How did that actually happen?
Well, it was interesting. As I said, we didn't sort of start with any policies and procedures and things like that. We were just a group of people feeling that there was a gap in what we needed to support us on recovery, in our recovery. And So I guess because I first contacted other people with lived experience of mental distress, it was predominantly, I guess mainly, that group of people. However, there was as we've evolved, there was lots of interest from their family members, their children, even workers in the field, as words got out, and so we put it the way that I guess we come together and is that of asking, so who's got something they'd like to talk about. And we had a worker, well, she wore several hats, but she was a family member. Her son had some challenges, and she wanted to come. She just wanted to come along. And we invited her because it's all through word of mouth. And so she came along and she wanted to be a part of it. But we have retreats. We go away for the weekend together. And during that weekend, sort of discussions came up about the fact that she didn't have some lived experience herself, and was this really the right place? And so I was able to facilitate a whole of community discussion about this, and the community is what we make it. It's what our needs are, and this lady would like to be a part of that. So let's have a discussion about that. And it was quite heated at times, but just so well received, and the outcome was that, well, we're all on a recovery journey. Family members on a recovery journey too, and are we really acknowledging that if we, keep our group just to this? And one thing that I like is that we do embrace diversity of experience, and so what's evolved from that is anybody can come to Recovery Rocks, whoever wants to be there, and we see you as who you are, and if you need to be with us at this time, then you're welcome. And so what's come from that is that we now have families, all the families come along.
Fantastic. So you didn't initially start out thinking, okay, I want to have a support group, but I also want families to be involved. That kind of just evolved from there.
Well, actually, I didn't want a support group, John.
Oh, okay.
No, I didn't want another support group. Okay. It was more a community.
A recovery space or community.
A safe space to be able to just be who I am with other people. You feel comfortable to be who they really are. A place where you can actually talk about the ups and downs of life, where you're not going to be pathologised. Yeah. You're just you, and that's proved to be quite a success.
So with broadening something to family members, was there, and you mentioned the heated discussion, I just want to tease apart that discussion, because these are the sort of discussions that really every support service or anyone working in the field needs to have, about, and that's what we're talking about today, family oriented practice. What were the pros and cons? What was the heated discussion? I mean, there's obviously advantages and disadvantages that might have been discussed.
That's right, and I guess it's probably also comes back to what we're used to. So, there's carer groups out there, there's consumer groups out there, there's COPMI groups out there for children. But where is there a place where we can all come together? And, there is, it's encouraging to see there's a few of these places, but they're few and far between. And I think recognising part of my recovery has been being able to step outside of myself and see things from a different perspective, to be able to see it from my ex-husband's perspective, my children's perspective, how what was happening for me was impacting on all of us. It was hugely valuable. I guess I encouraged fellow community members to recognise that these challenges that we live with, yes, they can be hugely distressing to us at times, but they're also hugely distressing to our families at times too. And if we've got family members who really want to make things easier but are not sure of how to do that, by sharing our stories, by answering the questions, by us being able to answer questions to family members, it helps.
What were the objections?
The objections were around, I don't want to upset somebody else, a family member. I might not be able to talk about what I'm really going through. They'll have different agendas. Yeah. Their interpretations might be different, and these are all just common, I guess, fears and anxieties. But also I was able to help people to realise that one of the biggest barriers we've found is this them and us. Do we want to be creating a them and us? Because that's what we'll be doing if we say, well, no, sorry, you're a them, not allowed in here. This inclusiveness of diversity of experience is really important. If we can get this right, then, and despite those, fears, I think creating the safe space for the people to have the courage to be able to name it and talk about it, has been hugely valuable. And to see the value in that, embracing that diversity in what we do has been an incredible part of people's personal recovery, but also in what we do as a community.
Now, you were able to take those objections and you've sort of been able to creatively work around them, because I could imagine if it starts off as a group of just people experiencing mental ill health and they're able to talk freely and feel safe, now their family members are here. So you've been able to sort of be creative about how you work that community so that there are times for the different groups.
No, we all come together, one space in my house, in my backyard. And I guess it's, I have, there's no certain this room, that room. We're all there together, we share a meal together. What generally happens is the children all play with each other, there's toys and things like that. I guess as adults, we all sit around and have some discussions. We have teenagers who come sit for a while, join in on the discussion and then go off on the PlayStation. It's sort of do whatever you need to do, yeah. And but everybody is welcome. As I said, key aspect is sharing a meal together. Everybody contributes to that, and it's just a place to feel accepted and be. And so there'll be times when anybody can say anything that they want to say and be heard. And just our last gathering, we had a young single parent family, the 14-year-old daughter. They've just lost her grandfather, and she was able to sit around and talk about how she was feeling with that grief, and feel comfortable enough to be able to feel, address the fears that she was worried that perhaps, she's getting depressed, she's finding it hard to get to school, and just feel support from the whole community, and to be able to normalise what she was going through instead of medicalising all. It was very powerful.
Fantastic. Now, just quickly, I love this idea of the warm line. Can you tell me about that?
Yeah, so I guess I had, through my work, I had heard about warm lines.
As opposed to a hotline.
Yeah, as opposed to a hotline. A warm line is peer run, and it has been trialled. It's very successful in other parts of the world. And drawing on that, I put to the community, because just as I was saying, and I did say a little bit earlier about those first 24 hours, having a family meeting in an inpatient unit, in actual fact it starts a lot before that point. And so if as part of your recovery you're able to create that awareness and know when things are starting to creep up, or
you might jump onto the warm line.
You might call the warm line and get a peer, somebody else from the community, who you might be able to just talk through what's happening.
So within the Recovery Rocks community, you've trained 4 or 5, a handful of people to man that warm line?
We have a handful of people, some warm line receivers, and we've also had to train the community on how to use this. We're not a crisis line, we're a warm line, and that's an ongoing process. We're doing something quite different. A lot of the other models of warm lines where there is a telephone centre set up and people are trained to go there. The difference with our warm line is that people are known to other people. And so that's an ongoing process that we're hugely.
No, it sounds awesome. Now, I'm going to throw it to the room for anyone that might have questions for Amanda. But while you're thinking of your question, my last question to you, Amanda, is it an important kind of paradigm or mindset to have that the whole family is in recovery? Because you've mentioned that a couple of times, and I just think it's a brilliant concept to think of the whole family in recovery, not just the individual. Yeah. Is that an important paradigm?
It is a definite paradigm shift, and I think I'd like to think we're working towards that, and days like this definitely encouraging. But I also know that it takes. It's not rocket science. What we do at Recovery Rocks is not rocket science, but it is a paradigm shift.
Yeah, it's powerful. It might not be rocket science, but it's powerful.
Just as powerful.
Yeah, awesome. All right, over to you guys. I'm sure you're burning with questions. Pop up your hand and we'll run the microphone to you.
Mine's just a simple one. How did you organise to get so many people on so many different levels, like all the different ages, to come together? Did you ask them about times? And
it's quite simple, really. I guess remembering Rose talking about the hamburger, we all know about the hamburger, and I strongly support the hamburger approach. But if you think about it, you've had a nice hamburger. How does that word get out? Where you got that hamburger, it's word of mouth. You know, like if you like that hamburger, then you'll ask for that. You'll drive miles for that, won't you? And so it's been a simple, as I said, we have no money. We are I guess we're built on reciprocity. So it's about really what you can offer, not just what you take. We're not another service. And that is that if there's a need from a community member, then it's put to the community, and look, nobody's done without. And I just create a space, as I said, and people come, they drive for miles, even 100 miles to my backyard once a month for a gathering. And I think that the word of mouth is what's also drawing services to us. That support workers and what it's
Just ask one at a time, please. Down here.
I'd just like to say congratulations to you for all the wonderful work that you do. From the inception of Recovery Rocks, what was the time frame of growth of participants or people that accessed the program, and what level is that at now?
Yeah, so from that first Australia Day barbecue 20 months ago, we had 12 people, and we now have 50 people on the books, I guess. We just take their information. We don't always have 50 people come around for a barbie at my place, but we've created a newsletter now. And we also have national and international supporters, allies, Recovery Rocks allies, and if anybody here would like to be an ally of Recovery Rocks, let me know. And so I guess, sorry, did that answer your question? Yeah.
Hi, my name is Kristen from Melbourne, Northern Area Mental Health Services. I was interested in your comment that you didn't want a support group. No, and I suppose in the northern area we've sort of been struggling to get our support groups going and to get regular attendees. And I'm wondering if this is sort of an evolution of what comes after a support group, what you have developed. And, in your role as carer consultant, you must have perhaps been involved in those sorts of groups. And I'm wondering what you see your group offering, how you've evolved from the support group model and what needs you're meeting.
That's a great question.
That perhaps support, as for more traditional support groups, don't now.
I guess there is value in support groups. Usually they're time framed, and they are ongoing. They're talking about the same sort of things over and over. And I think this is more about sustainability. This is a community that grows, and that from every month, I guess the way it's facilitated is whatever the need is, rather than there's a preconceived topic, there's, you know, what we're talking about. And I guess, yes, it is a step beyond, and so much so that it, you know, it takes on a life of its own, which good groups can do. But this also, we also provide support, even though we meet monthly. This is ongoing, so we're receiving up to 20 warm line calls a week.
Wow.
We are providing support. I provide support in my home, so we have a sort of crisis support, and if people need support within that month, the you know, community members who are interested in peer support or interested in learning more are there and available. So it's not just a weekly support group. It's a community.
I'd just like to thank you for your speech, and I was just wondering, you were speaking about a safe place where people could be without being pathologised, and I just wondered if you could give some hints for a peer worker. I'm a peer worker, and I work with occupational therapists and nurses and social workers. I was just wondering, can you give me some hints how I can help the staff members to see the person first?
It's a good question, and there's no easy answer to that. I guess it's a personal thing, and it's you want to work on your practice as a peer support worker. It's about not reading the case notes. It's about the questions that you ask. It's about what's happened to you rather than what's wrong with you. It's about asking the person's name. Tell me a little bit about yourself, not what your diagnosis is. It's about asking questions, not just about your mental health, but about your physical health, about your life, about your hopes, your dreams. And it's trying to develop a relationship with the person with whom you have the honour to walk alongside on their recovery journey.
Hi Mandy.
Hi Dave.
I was actually one of the first 12 to go to that barbecue at Amanda's that day. What attracted me was the fact that it was 11 other people that actually had some form of mental distress. We weren't asked what type. It was simply a community barbecue where we could socialise on an equal basis with other people. And that's what drew me to the actual barbecue. I'm still a member, but I actually don't go anymore. I smoked for 48 years, or 38 years, and so I can't go anywhere where people smoke. But I'm still in touch. I've become involved in Richmond Fellowship, just been offered a contract to work in their Hearing Voices network. So it's actually been a total support from both Amanda and also Donna, who's over here holding up the thing. And I've met so many wonderful people, and as Amanda's saying, we don't say what's your diagnosis, what's the label or the hat you wear or any of those things, and we're really totally supported to continue growing. I've just gone back to uni, so I'm over 50, and yeah, I'm just really grateful for all the support that the network has given me. Thanks.
Dale, it sounds like you still feel part of that community, if you like, without necessarily attending sort of meetings. Would that be fair to say?
Yes, I do, and I still have contact with other people, and even coming to places like this, it's still, oh hi Dale, how you going, and it's just very friendly, very social, so and I get the newsletter every month, so I can keep abreast of what's happening.
Because that's a distinction between a support group, say in a community, is if you're no longer at the support group, you're really no longer part of that support group. So, you might get exited or something, but you can't really get exited out of a community, can you?
And recovery is, several steps forward and several steps back, and we just respect where you're at that time, and if we're there, and that's
Isn't that wonderful?
Can I say something too? I'm actually the same as Joe. I don't go to the group that's too far away. I've got work.
Yeah.
But I feel the same about Amanda. coach, very welcoming, and she's a wonderful lady with everything she did. Straight away you feel at home, and it was wonderful sharing the lunch, but I don't go there, but I still have that feeling, particularly when I see Amanda and when I see her.
Yeah, sensational.
Can I just say that I think there's a risk that we see Amanda as a hero. And if we do that, we're copping out from reflecting on our own practice and making some changes. Amanda said it's not brain surgery, it's not rocket science. And the theme that seems to be coming through a lot of what we've talked about today is that it doesn't matter whether we've got mental illness or not. We all need validating, we all need listening to, we all need respecting. Brooke's story, she didn't get it in those early days. The story that you're telling, people are getting that. It's not rocket science. And you're not a hero, you're just doing it. And we need to do it.
Thank you. Are there any other questions? I think she's a hero anyway.
Yeah.
Are there any other questions?
I'm just interested, and I don't mean this to be any jinx, if you were to become unwell, are there other venues, people that can take on this role? I'm sorry.
I'm actually in my 8th year of recovery, and some days are tough, but I've done a lot of work, and I choose recovery, and I would be more than aware of I guess, signs for myself when things were, a little bit too difficult for me. But because the community is so strong, it's actually happening this weekend without me.
Okay.
And can, and does. And I'm very good at knowing when to say, well, actually, no, I can't. And it's actually really encouraging to know that there are so many others in the community now that can. And it's not about me. It's,
That's important. If anybody was thinking of doing this, that they were in the right place to be doing it, and they had somebody to support them, and they had feelings as if they weren't alone. Because if you were trying to do this on your own, I'm not saying you are, it could be so overwhelming. I'm sure to feel that you have a responsibility in a way, to all these people.
Well, it's not my responsibility because it's not about me. This organically has evolved, and it's about us.
Yeah, I suppose it's just because it's at your venue. Yeah, that's what I was thinking. If anything would have happened.
I have a park down the road. I guess recovery is about being flexible, and we're all pretty resilient, and we're able to just go with that.
We've only got time for one last question from Kerry, and we're going to wrap up, but avail yourself for Amanda with the rest of the day too, because there's just so much to talk about. Thanks.
So I'm a member of the Recovery Rocks Community as well as a family member. Always feel welcome and just a human being there. Amanda, I wanted you just to talk a little bit about risk. I guess that's something that services often talk about, particularly the work you do with people who are in distress and working with services and dealing with those risks a little bit.
So I guess sometimes there are times where it might be, I might be unsure about, how Recovery Rocks Community can best support the family in particular. And I just have that conversation with the person and ask them how they would like, how they would like to best receive support from the community and guided by the family as a whole. And that's not always easy, but so far it's worked well. And I think using the handover approach, I suppose, as well, and knowing that we are not the only support available to a family. Asking the question about what supports are already there from services, drawing, perhaps, sitting alongside a family member in having a conversation with their existing support services, and we've done that, I suppose, in facilitating support on discharge from hospitals, where a family member has decided, and I can just perhaps give one example where a family, the mother chose not to want to go into hospital in her distressed state. The children had become quite concerned about the distress, and so they had rung emergency services, had rung the ambulance, and when the father came home, they called me. I was able to go around there, and we were able to talk. And obviously, once emergency services had been called, you have to follow through and go to the hospital. And it was decided that I went with Mum to the hospital, and the dad stayed home with the children. And then after talking with the hospital, we came up with the plan that the mother come home, stayed with me for a few days, things settled down with the family. Then we went back and we talked, and the whole family had the opportunity to be able to talk about what had happened. We were able to talk about what was best, and it worked well.
Brilliant. Would you show your appreciation for Amanda?